As the summer heats up, many of us are heading to beaches, lakes, pools, all to cool off. We want to make sure that you have fun without any of the ill effects that come with all of that. So with us today is Dr. Philip Lamptey, Medical Director of Cone Health Virtual and Urgent Care. He's here to share recommendations on preventing water-related illnesses and as well what to do if you are exposed. Okay, so Dr. Lamptey, let's just kind of start with pools because that is one of the most common places for folks to cool off around here. If someone has a cut or an open wound, can they get into the pool?
So it depends on the type of wounds. For people who have surgical wounds, who have piercings, those who have new piercings, and those who have infected or draining wounds, typically, or bleeding wounds, typically we say that stay out of the pool. For those with minor cuts and abrasions, if they will enter the pool, they should make sure that they have a waterproof wound dressing over the area before they get in the pool.
Gotcha. Okay. This is very common. You know, you go to the pool, you're playing around, you accidentally swallow a whole bunch of pool water. How concerning is it? At what point is it concerning, and what should you do about it?
Generally, we say that pool water, you should not swallow pool water. And if you do, I would say you should not panic. You should look out for symptoms like nausea, vomiting, abdominal pain, and diarrhea. If you have any of those things after you've been to the pool, then it's time to reach out to a provider or a health professional for advice. And with Cone Health, you could do that virtually through the comfort of your home, or if you live near to any of our urgent care sites, then you could come through and then we'll evaluate you and give you the necessary medical advice that you need.
I guess we're worried about chemicals and maybe other things that could be lurking in the pool.
Yeah, so you're worried about chemicals, and then so you're worried about infections also that could emanate from you drinking pool water.
Gotcha. Okay. All right. So let's talk about splash pads and those kinds of things. Kids, adults and kids like running through all of them and that kind of stuff. What are some of the do's or don'ts to avoid spreading or being exposed to germs in that kind of water?
I would say that splash pads and water fountains are always fun for adults and kids. You should always make sure that you have the right footwear so that you don't slip and fall. Also, if you have any medical condition, you're not feeling well, or you have diarrhea, that is not the time to get into splash pools because you might spread whatever infection that you have to other people enjoying the splash pools and water fountains as well. And those are mainly the things that you should be mindful of. And also stepping on the faucets that the water comes out from or shoots out from is also a thing that we don't encourage because it also contributes to spreading of infections if there is any.
All right. Of course, like kids and stuff, they like to put their hands over them or their feet over them, that kind of thing. And you're saying we should make sure that we tell the kids, hey, let's not do that.
That's right.
Okay. All right. Let's talk about inflatable or plastic kiddie pools that folks use at home. What do we need to keep in mind there?
Yeah, this is one that we use a lot for birthday parties or hanging out on the weekend with other kids. We should always remember that drowning is still a concern, especially for kids. So adults should be vigilant because drowning takes just a few seconds and kids can drown in silence. So that's one thing that adults should always be vigilant when there are kids involved in that. The second thing also is that after you finish using your inflatable or plastic kid pools, you should always clean it. And that helps prevent water-related illnesses that we may encounter using these inflatable devices.
Okay. All right. Let's kind of switch to like bigger bodies of water, like oceans, lakes, that kind of thing. So often, you know, you would hear people say, well, I have a little minor cut, but the salt water is going to cure it. So let's kind of talk about that. What are the do's and don'ts when it talks about like having a cut or something like that and then going into a beach or lake water?
I think with natural water bodies, if you have any abrasions or cuts, or if you have any of the things that we talked previously, a surgical wound, a new piercing, bleeding or infected wounds, it's best to avoid it because it's not like a pool where we have is chlorinated. to take care of bacteria and things like that. So you're more likely to have infection if you don't have one when you get into natural body water or a natural water body with open wounds and cuts and other skin conditions.
So if you do swallow water or you do have an infection and you go out, what kind of illnesses are we talking about that you would get?
So we're talking about things like swimmer's ear, which is very common. We're talking about diarrhea after having been in a water body or a pool. We're talking about rashes on the skin after you've been exposed to natural body water or water bodies like lake, rivers, and the ocean. And we're talking about skin conditions as well, other skin conditions, and also irritated eyes that
Uh,
could emanate from you getting exposed to the pool,
okay.
or any other water bodies.
All right, well, let's dive a little bit more into the swimmer's ear. What is it, and then how do we prevent it?
Swimmer's ear is the infection involving the ear canal. Usually happens after water gets into the ear canal and you're not able to get the water out. For people who have recurrent swimmer's ear, it's not a bad idea to get earplugs if you're going to be in the pool or the water body for a long time and you're going to submerge your head in the water. The other thing you could also do is to shake your head back and forth to try and dislodge the water in the ear canal, or sometimes you hold your earlobe and then maneuver that to get it out. If all of this does not, help with getting the water out and you end up getting swimmer's ear, you should reach out to a healthcare provider for evaluation and treatment.
Okay. All right. So if you're, out and about and you're, by a body of water, maybe you're also camping, and so you're not necessarily sure what's causing whatever illness you now have. So let's take it from here. If you have diarrhea after you had been somewhere in the water, you should do what? You should go to urgent care or you should call your doctor?
So usually those illnesses will subside in a few days if it's not severe. If you still have diarrhea after 2 to 3 days, then that's the time that you could reach out to a healthcare provider. You could do that again, I would say, through the virtual resources we have from the comfort of your home to get advice, or you could go to any of the urgent care, schedule an appointment before, or just walk in to see a healthcare provider for treatment or for advice.
Okay, it's good to know what, the passage of days. All right, and what about like if you do get that skin rash after being in the water? Is that something that you call upon immediately or do you wait a few days?
I think you give it a couple of days as well. And if it's not getting better, or if it's getting worse, or if your skin becomes red, like it has an infection in the skin that is spreading fast, then you need to see a provider as soon as you see the infection spreading fast.
Yeah, so like if it's oozing or anything like that, you need to go see the doctor.
Absolutely, yes.
Okay, and then the same thing like with the red, itchy, irritated eye. I'm guessing some kind of flushing like with a Visine or something like that, some kind of eye wash. But how many days until we then say, nope, we need to go see somebody?
If you have a yellowish discharge, if you start having worsening eye pain or irritation, if you have changes in your vision, then you need to go and see a provider. But if your symptoms are improving after you came from the pool, then that you can wait for a day or so to see if the symptoms get much better before you make that decision to reach out to a provider. But if you have any questions or if you have any concerns, you don't have to wait. You can always reach out to providers for an advice so that you can be rest assured that you're doing the right thing, or you can go in and get some more advice, evaluation, and treatment, and the necessary medications if indicated.
All right, we have just about a minute or so. Do you have any final thoughts that you want to share about any of the sicknesses or how to schedule like a virtual appointment or anything?
I would say a few things about natural water bodies. Always pay attention to the local notices, and also if you go in there and the water looks very cloudy, then you should know that that means that there is a lot more germs in the water. If you see drain pipes opening, draining into the whatever water body or close to it, it's not probably a good idea to go into that water body. And I'll also say that we have options in terms of seeking care. The virtual options are there where you can leave a message for a provider to reach out to you, or you can schedule to talk to a provider virtually from the comfort of your home using your smart devices. And also, you could walk into any of our 8 urgent care sites to get evaluation from a provider. You could schedule ahead of time, or you could just walk in to get care.
Great. Thank you so much for your time and your expertise in keeping us all safe. We appreciate that.